Perfect. Well, good afternoon and good evening, everyone, and welcome to today's webinar brought to you by the American Cancer Society National Roundtable on Cervical Cancer and the American Cancer Society National HPV Vaccination Roundtable. I'm Joslyn Paguio, a cervical cancer survivor and a patient advocate and the host of this Survivor podcast currently in its fourth season. I'm also a mom of a spunky and beautiful 11-year-old daughter. We're thrilled to have you here to join us for the second installment of our patient webinar series. The first webinar addressed cervical cancer basics and can be found on cervicalroundtable.org. For this webinar, we aim to demystify the topic of HPV vaccination and provide you with clear answers and practical tips. HPV is an extremely common infection and can lead to 6 different cancers, including cervical cancer, and all this can be prevented with the HPV vaccine. Talking about the HPV vaccine with your children doesn't have to be hard, and our esteemed panelists are here to help us navigate this important discussion. Unfortunately, Dr. Fiscus could not be with us tonight, but we are honored to have with us Dr. Rebecca Perkins, who is a professor of obstetrics and gynecology at Boston University School of Medicine and Boston Medical Center, and the current co-chair of the National HPV Vaccination Roundtable. She will be providing her expertise on immunization. Melissa Villa from the Indian Health Council brings a wealth of experience in community health initiatives. Sarah Vivo from the Indiana Immunization Coalition and a member of the Unity Consortium's Moms Advisory Council, who will share invaluable insights from her work with vaccine advocacy for teens and young adults. And also we have Andrew Gonzalez, the Director of Community Health at Champions for Health, who will discuss advocacy efforts aimed at increasing HPV vaccination rates. With such a knowledgeable panel, we're confident that today's discussion will provide you with valuable insights and information to enhance your understanding of the HPV vaccine. So Dr. Perkins is with us for a short period due to prior engagement. So we're going to jump right into the discussion. So Dr. Perkins, I think she's here. There
Sorry.
she is. No, there you are. So Dr. Perkins, could you, go through the basics of HPV? I already said HPV is very common and really, can lead to 6 different types of cancers. But can you give us kind of what is HPV and how it's transmitted? And we can start from there.
Sure. So HPV is an extremely common virus. HPV stands for human papillomavirus, and they're actually papillomaviruses for mice and horses and every sort of mammal you can think of. And it's a skin virus, so it's transmitted by touching. And if you are a human, the chances are over 80% that at some point in your life, you will be exposed to or have an infection with human papillomavirus. So people typically think of it as a sexually transmitted infection, but in fact, I would really prefer that people think of it as a human infection because research shows that over 50% of people are infected with HPV before they ever have sexual intercourse, and everybody pretty much will have it at some point or another. So I hope that in the conversation today, we can remove some of the stigma associated with it.
No, that's great. And thank you for helping us understand that. You mentioned the HPV is a virus. Can it go away on its own? And does it require treatment? Just for our audience to understand, because it's so common and sometimes we don't know we have it sometimes, right?
Right. So HPV, I'm jumping a little bit ahead, but HPV
Yeah.
vaccination can prevent someone from ever getting HPV, which is by far the best thing. And that's because we know now with amazing data that it's over 90% effective in preventing cervical cancers, and we expect it will be as good with the other 5 cancers as well. But also because going back to your question about does HPV ever really go away, the answer is maybe. So we definitely know that HPV can reactivate. Data indicate that the most common reason for someone to have a new positive HPV test on their cervical cancer screening after testing negative in the past, if they're in sort of midlife between 35 and 60, if they are in a monogamous relationship or not sexually active, that is because of a reactivation of an old infection.
Got it. Got it. And I know that we jumped a little ahead and we're going to go back and forth a little, but I know, as you said, the HPV vaccine is the best preventable way to prevent us from ever getting these. And again, we're looking at the different types of HPV because I know that there are high grade ones that are the ones that lead to cancers like cervical
Mhm.
cancer, right? So those are the ones that we are very more concerned about. And those are ones that are protected by this vaccine, the HPV vaccine that we have.
Exactly. So the currently used HPV vaccine in the United States is the 9-valent Gardasil vaccine, and that has protects against 2 strains that cause genital warts, and then the 7 most common cancer-causing strains. So once you're protected against those 9 strains, there that covers over 90% of the types that cause cervical cancer. So you are set.
That's great. And I think it's just perfect. It's a cancer prevention, vaccine, right?
Yeah.
It does that. There's been a lot of questions about how the HPV vaccine works. Is it a live virus? Is mRNA? I mean, because of COVID and the vaccines, there's a lot of kind of discussion about that. So can you kind of explain, address that, explain that how the HPV vaccine works?
Yes. So it is not a live virus, which is good because that would be terrifying for telling you this is a virus that causes cancer. Now we're going to inject it
And we're
into you. No,
right.
no, that would be not good. It is actually, and it's not an mRNA virus. It was actually before that technology was in wide use. It is made up of, so the HPV is the virus come when it leaves to try to infect you, it's inside of a protein envelope. And so you
Mhm.
have the protein envelope, and then inside the envelope is the virus. And the type of proteins that make up the envelope are called L1 capsid proteins. And so what the scientists did who invented the vaccine was they made in the lab these L1 capsid proteins. So it's just proteins and no virus at all. And they actually that's what's in the vaccine, and your body sees that and actually makes an immune response that's much, much better than it makes to the virus, and that's how people stay so well protected.
Oh, that's great. That's a great explanation because I think a lot of people are very worried, right? Like you said, live virus, do we put that in you and things like that. So I'm glad that we're getting away with that misconception of it.
Yeah.
Now let's kind of talk about the guidelines because I know that there are specific guidelines for different age groups. So could you address kind of explain what are the guidelines for those age groups, when they should get the 2, when they should get the 3 shots?
Yep. So everybody who is currently aged 9 to 12 should get their HPV vaccine because we know that when you get the HPV vaccine on time at 9 to 12, you will not get cancer in the future. And we know that because we've now had it for almost 20 years. And so in countries with beautiful organized healthcare systems and registries, not us, we can see that cancers don't happen. So this would be, say, I don't know, Sweden, where they have this lovely registry of the entire population, and they compared girls who got the vaccine in early adolescence compared to over age 18, and found that there was basically no cancer in those who got it in early adolescence. There was a reduction, although less, in the ones who were over age 18 when they got it, because some of them already had HPV. And then in the ones who didn't get it, you really started to see cervical cancers happen. And this is in women under 30. So these are young people who are in a program where they're getting screening. So, it really just shows tremendous potential of the vaccine when you get it on time. So if you start at 9, you should start at 9 to 12. And then it's just 1 shot a year for 2 shots. 2 shots are all that's recommended up if you start before the age of 15.
Okay.
After the age of 15, 3 shots are recommended. And that's because the immune response of those early adolescents is better. They produce more antibodies. So they make enough antibodies with 2 shots to be protected for basically their entire life. We now have studies going back more than 20 years from the original vaccine trials, and everybody's still protected, which is incredible. I heard a lecture by one of the NIH scientists, and she said that once you have a stable antibody level from a vaccine for more than 10 years, you can feel very confident that it's never going to go away because the type of immune system cell that it has generated is a cell that you'll have for your whole life. So basically, it's 2 shots and you're good to go till you're 105.
So 2 shots until you're 15. After 15, it is 3 shots,
After
correct?
15, it is 3 shots, yes.
It's three
And it's,
shots.
yep. And it's still recommended for everyone up to the age of 26 and 27 to 45. It's optional because by that point, it may help, but most people will already have been exposed to HPV, so it helps much less than it does if you get it in early adolescence.
And I know that you said it's very effective. We have 20 years of data to back this up. So let's just clear that up with the misconception. We have 20 years of data to back this up. And do we have a percentage of efficacy? Like how effective is the HPV vaccine? I know you said it's very
Like
effective.
more than 95% against cancer. Like it's
Perfect.
amazing. It is. This was my, as a gynecologist who treats patients with cervical precancers, this was sort of my favorite vaccine out of the gate. But it's been really fun to be in the HPV vaccine space for 20 years because the news just keeps getting better. It started with 3 shots and we're going to need a booster. And then it's like, oh, we don't need a booster. And now 2 shots work really well. And, now the WHO says, maybe even 1 shot's going to be enough. So the news just keeps getting better. And we know we have more long-term data showing more cancers being prevented. And then my favorite HPV vaccine fact from Australia is they have a very high HPV vaccination rate. And now that the girls who got the HPV vaccine when they were teens are having babies, they found lower rates of preterm labor because HPV infection is associated with preterm delivery. So it's just the news keeps getting better. I love this vaccine.
Oh, that's great. Now, okay, we talked about the efficacy. We talked about how effective it is. How safe is it? Because I know a lot of parents are wondering how safe is it for children and teens to get it? And you have the 20-year back, and I think we just want to clearly state how safe this is for teens and children.
It is extremely, extremely, extremely safe. It has been studied up, down, and sideways. The safety is constantly monitored in 180 countries. They looked for evidence of over 60 different possible short and long-term complications and found no evidence of any of them.
Oh, that's great. Good. Okay, so now since we've talked about HPV, the basics, we talked about general questions about the vaccine. I want to roll into now kind of addressing some of the concerns and misconceptions that has been going around about the vaccine. So one, and again, some of these questions, some of these questions I did receive from a lot of parents and other general public questions, but can you address, and you mentioned this earlier about preterm labor, but can the HPV vaccine cause infertility or any other long-term health issues?
Definitely no. I actually was fortunate to work with a very cool research study, the Presto study, where they looked at people who were attempting pregnancy and asked them various questions about various things. And they found, and they looked at how long it took the couple to get pregnant. And so one of the questions we asked was, had either the male or female partner had the HPV vaccine? And we found that for most people, it did not affect their time to get pregnant. And for people who had a history of chlamydia or another sexually transmitted disease, they actually got pregnant faster if they'd had the HPV vaccine. So again, only good news.
That's great.
Yeah.
All right. So, and I know that, we talk a lot about cervical cancer and, and how it's linked to HPV, but really it's the vaccine is good for both boys and girls, right? I mean, this is the thing. A lot of people think it's only for girls who have a cervix, biologically have a cervix, but we're recommending this for boys and girls.
Yes. And it's actually cervical cancer is right now the only HPV related cancer that we can screen for and do some prevention without vaccination. But oropharyngeal cancers, which are cancers of the tonsils and base of tongue, are 6 times more common in men than women. And they've increased by about 400% over the past few decades. It's the head and neck surgeons are considering that an epidemic. It's all HPV related, and the vaccine has an indication for preventing head and neck cancer. So it's incredibly important for boys and really anyone who has a mouth.
Right. Anyone has a mouth, a cervix. Let's just say anyone, right? At this
Anyone.
point,
It's human.
anyone.
It's human
It's human.
papillomavirus. If you're a
Right.
human, this vaccine is for you.
Perfect. Okay. So another question we got was, since, the vaccine is recommended between ages 9 and 12, and, really kind of for that two-dose one, really kind of hit it home. And that's kind of the time when girls start having their puberty. So some of the parents asked, can the HPV vaccine cause any issues with puberty? Maybe
Nope.
accelerate it or anything like that?
Nope. And actually,
Nope.
one of the reasons why it's the recommendation has moved down to 9 from 11 is partly because people aren't in puberty at that point typically, and so there are less questions, there's less concerns about will it, interfere with anything, which it doesn't, but it at least, will ease people's minds because it's not even a concern. And then the kids don't have to get as many shots in a single visit.
That's great. Perfect. And another question we got was, if they got the vaccine, do they still need to use condoms? Because
Oh, yes.
we have this sexually transmitted, and then so that this is the question, and I love having these questions because it addresses those misconceptions that we have in society already about this. So
If
yes,
only HPV were our only disease that could be transmitted that way, but it is not. There's HIV, gonorrhea, chlamydia, herpes. Syphilis is making a giant comeback. So sad to say, but here in the OB world, the amount of congenital syphilis we've seen has not been seen in decades. So yes, please, if anyone is sexually active, they should definitely use a condom at all times.
got it. Good to know.
Because even if
And
they might not get
then
HPV, there's plenty of other things they
there's
can
other
do
things,
not want.
right? But that's for another webinar, guys, not this
Yeah.
one. So the other thing I asked is, do people who have already been exposed to HIV, and I think you mentioned this before, still benefit from the vaccine? And that's a thing because as there's that recommendation as you're older, you have the option for the 3-shot. Do you recommend women or anyone to get those, both women and men, sorry, to get those optional when they get older?
So there are very good data showing that getting an HPV vaccine will not treat an HPV infection that you already have, which makes sense because vaccines are prevention. Theoretically, it could prevent you from getting a future infection. So if somebody wants to get it, they certainly can get it. And we have, extraordinary safety data, so it's very safe to get it. The only group where there are data indicating that it may be helpful is in someone who is getting a treatment for a cervical precancer. Data seem to show that getting a vaccine at that point can help reduce the risk of recurrence. And that may be because you've treated the infection that they had with that excision procedure, and maybe you'll prevent them from getting reinfected with the same very aggressive strain from their partner or something like that. But that's the only group where I have seen data showing that it's helpful as an adult.
Great. The last question I think I wanted to ask you before you step off is side effects, because we're always, we know the usual side effects of getting a vaccine. Your arm hurts, it burns little, you might get a little, wheezy seeing the needle as I do, but is there any other additional side effects? Because there's always people talking about, oh, I got this and I got sicker. And so besides those common ones, is there anything we need, should look out for?
No, there's no, as I said, there have been lots and lots of studies looking for every side effect under the sun and really not showing any, other than the routines like, your arm's a little sore, maybe feel a little achy for a day, something like that. And, when they were specifically starting with teenage girls, sometimes they would faint mostly at the sight of the needle, and often if they hadn't had breakfast. So, if you're taking your kid to get a shot, please make sure you feed them first. But otherwise, nothing that people should be concerned about.
Perfect. Was there, before you take off, any last minute, like this is what, besides that this is a vaccine for all humans, because I got that message hit home perfectly. Any other last minute, tidbits for our just, people who are listening in?
I would just reiterate that it has been around for 20 years at this point. And so we have great data on a population level that it prevents cancer and that it prevents preterm labor. And it seems to last a lifetime. So it's a great vaccine.
It's a win-win, right, for everybody. Win-win all around. Thank you so much, Dr. Perkins. I appreciate you being on and help us address. So we're going to jump a little bit. We're going to jump to Sarah to talk about public health and access. So Sarah, Could you, explain to us, why is it so important for the widespread HPV vaccination? Because if it's cervical cancer and individual health, why is it so important that everyone gets it?
Yeah, great question. Um, I'm hopeful that some people on the call maybe are familiar with herd immunity, which is something that we talk about in the vaccination world. Um, but herd immunity refers to that when you have enough people vaccinated, that you actually dramatically reduce or even stop the spread of a disease in your community. So if you get vaccinated against HPV, that's wonderful for you. But what we know is that if you get vaccinated and other people in your community get vaccinated, then you're actually stopping that transmission. And so it's really important, again, for all genders, um, that we focus on getting people vaccinated so that they are protecting themselves, but they're also protecting their partners. And a lot of times I like to especially bring up to parents that you're really protecting your future grandchildren, right? So, as cervical cancer can become a fertility issue. And so, having that protective measure, if you have a son, then you are protecting the people that he is with, which again, your future grandchildren. And if you have a daughter, then you're protecting her. But it goes beyond that and protecting the community by preventing spread.
Oh, that's great. That's great. Um, so another question is, how can healthcare providers address vaccine hesitancy and resistance in their patients? This is always a thing. I mean, we have so many vaccines and sometimes gets a little confusing. So what do you recommend for healthcare providers to really help with that hesitancy?
Absolutely. And in the post-COVID world, there's more hesitancy than ever, unfortunately. And so it is really important that providers take the time to address questions and concerns from parents. And I think one of the most important aspects of that is realizing that I, as a provider, if I'm at a clinic and you as a parent are asking questions about this vaccine, we both want the same thing. We want what's best for your child. We want to keep them healthy. We want to keep them safe. And so asking questions is not necessarily a bad thing. I think people automatically assume that when you start getting a little bit of pushback about something, whether it's vaccines or anything medical, that means that they are resistant or that they're already have made up their mind. And that's really not the case most of the time. Parents want to understand, and honestly, teenagers want to understand what is happening with their bodies. And I think having just some really basic conversations, addressing many of the things that we've already spoken about, the safety of the vaccine, the wonderful things that it can do for you and for your future, all of the aspects that, you know, we know are great things about this vaccine, and then just addressing concerns that, the reason that we want to do it at this age is because we want it to be protective. We want it to be before you're exposed to the virus. And so a lot of times we talk about it as an analogy of, you know, wearing a seatbelt or putting on a bicycle helmet. Those are things that you're hoping you're not going to get into an accident, right? But you're doing those preventative measures, and vaccines are very much the same way, and especially the HPV vaccine. And so taking some time to have some compassionate response to parents who have concerns, relating it to that preventative piece, allaying their fears, I think it's really important. The other thing I think that is really important is not to give up. So a parent might be a little bit blindsided that their child is ready for the HPV vaccine. I've seen that many times. Parents come in and they think that they just need, a tetanus and a meningococcal, and they're ready to head out the door. And it's like, oh, wait, you can get this HPV vaccine. And I've looked at many dads, especially who have the deer in the headlights look of, oh, I don't know anything about that. That wasn't on my list for today. And so they may not be ready to answer right then. and that's okay. They might need to go home. You can give them some great websites, some like the HPV Roundtable, the CDC. There's some great pieces of information over at CHOP, the Children's Hospital of Philadelphia, their Vaccine Education Center. Let them go find some good resources, get the information they need. And then when they come back, make sure you ask again, because just because they weren't ready the first time, that's not a no, you know? And so I think really building that relationship and keeping open communication with parents is really important.
And honestly, this webinar will be publicly available, so you can always refer to this webinar as well, right? So that it's just a plug for this webinar. That was great, and I think it's great because you're that point of the cross of it's not a no. It could just be right now I'm not ready, but and that's the great thing about the vaccine, that there's a range. I mean, from 9 to 12, we really highly recommend 9 to 12, but all the way to 15, right? So you have some time to digest this information, get really informed before you make that decision. And again, this is the area where we want to make sure parents are informed, and not just parents, you said teens, right? Because teens are learning so much information as well. So, I know you covered quite a bit of already information, but is there anything that parents or guardians can do themselves actively to, besides looking at that, information? But I know you mentioned, you said talking about it, right? So talking about it with your kids is probably a great idea as well.
Absolutely. And, I have teenagers myself, and they are becoming more interested about taking charge of things, and that includes everything from driving the car to a football game, or making sure that they have their stuff ready for school, or their meetings for their clubs, and they're more interested in taking on those adult roles. And so I think we are starting to see that more and more teenagers and young adults are interested in taking charge of their health care, and it becomes a little bit difficult because of the age of consent. In a lot of states, teens can't make that decision on their own, whether they want to be vaccinated or not. It does vary state to state. So that parent message is also really important. But I think that putting the two together is what makes it really impactful, is if parents and their kids can learn together and have open discussions about healthcare and about health topics, including vaccinations, and giving teens an opportunity to ask questions in the office or at a clinic about their vaccines. Again, I don't think that we should be viewing questions as a bad thing. I think it's wonderful that people want to know more about their health and what's going into the body, and the mechanism of it. Vaccines, I work in the vaccine world, and vaccines are a miracle. It's basically we put something in our body that's like a disguise, right, that makes them fall for it, and then they build up a defense system, and then when the real thing happens, they can defend against it. So I'm always, all for people learning more about the mechanism behind vaccines and their health. But I think the other really important piece of that question about getting that information is making sure that we have trusted sources. And I know that this is going to be super disappointing for some young people, but TikTok cannot always be trusted. And so we really have to make sure that we're figuring out who our trusted sources are. And that's different for different people, right? So if you have a close relationship with your doctor, and we would like to call that your medical home. And I really encourage anyone who doesn't have a medical home to find one. And that's a provider that you've seen on a long-term basis, that you go to well checks for, that you have developed a relationship with. They know your history, you know them. So if you have that relationship, A+, you can go and talk to your provider, because they're a great source of information, and it's somebody you already have a relationship with. If you don't have someone like that, I know there are some people that don't like government sites. The CDC is a great place to start. But the great thing about HPV is that there's so much information out there because it has been researched so much. So again, the American Cancer Society's HPV Roundtable has fantastic information. We also, as I mentioned before, the Children's Hospital of Philadelphia, they have their vaccine center that again has wonderful patient-friendly information. And go find a source that you really trust. If it is your local children's hospital, go and look and see what information they have. But I just really would encourage you to find medical professionals that produce content that you really trust, rather than just by talking to grandma or looking at social media.
Or like the hashtag on TikTok or something, right? Like let's
Right.
try to go with a more medical professional. I totally understand that. Um, Now let's kind of go into now the cost of it, because it's always, healthcare is always a big thing and there's always a dollar amount with it. So what's the cost of this vaccine? Is it covered by insurances? Is it, between, private and public insurance? Is there a difference? And, could you speak a little bit about that? Because I think that's another thing with healthcare. I mean, with healthcare things.
Sure. So there's good news and bad news. So the bad news is that as far as vaccines go, HPV is still a relatively expensive vaccine. Um, it's not one of the, $10 flu shots or $20 flu shots that you can get, unfortunately. But the good news is that it's widely covered. So if you have pretty much any private insurance that has a vaccine plan, it is going to be covered. If you are uninsured or underinsured and you are under the age of 18, you qualify for the VFC program, which is Vaccines for Children. It's a federal program that is in all the states, and you can go and get your vaccines at no cost. There may be an administration fee depending on where you go, but many times this is offered through your local health department. And so that's a great resource to go and get that vaccine at no cost, which again is, great because, like I said, it's a little bit of a pricier vaccine. Once you do go over the age of 18 is where things get a little more tricky. So depending on your state, you might still be able to access free vaccination federal programming, but it really does vary state to state. So really the best thing in that situation is to go visit your local health department or give them a call and find out if there are programs that you can qualify for if you're uninsured and you still want the HPV.
And, actually speaking of that, I was so happy that my local community actually had a vaccine drive for kids before school started, and HPV was on there. So it was great to see. And there are resources out there. So if anyone's listening and wants to get their child vaccinated, there are resources. Just, you're gonna have to look through the health department, like you said, but there are, and I can attest to that. There has been talk about and actually going back to that, the vaccines are available in multiple areas, not just doctors' offices, but we can get them in pharmacies. I've seen them in CVS, right?
Absolutely. We have done such a good job. And I think that the pandemic really was a catalyst in this area, in making vaccines more accessible and for people being able to find vaccines at different places. Again, I'm a big advocate for the medical home. So if you can go and see your doctor in your medical home, that's always what we would recommend. But you know what? Like I said, mom of teens, I know how that works. And I would be lying if I said that I haven't taken my kids to the pharmacy to get their flu shot, because it's just very convenient. And they have hours that are outside of, a 10 to 3 health department or things like that. So, yes, there's definitely different places that you can go. So I mentioned the health department, I mentioned your medical home, I mentioned pharmacies. There are also clinics that travel in the communities in some places. And so you might be able to look for pop-up clinics, especially in back to school season. I know that a lot of places are having, in community areas where they come in to do school vaccines. And many times they have a wider range of vaccines, including the HPV vaccine.
And
So,
we're gonna touch base on the community efforts with Melissa and Andrew in just a minute. But one last question for you about, schools, because there's been a lot of talk. I'm from California, and there's been a lot of talks in other states about adopting how HPV can be either required or recommended. So, I know there's some states, right, that require HPV. Is that correct? Or recommended? How is that going?
Yeah, there's just a handful of states right now that require it as a school regulation. And there's a lot of red tape around that. And again, it varies state to state. I live in Indiana, and the way that our legislature has spoken about vaccines for school is that it has to be a disease that is regularly transmitted in a school environment. And so that makes it a little bit tough because while some people might argue that it could be transmitted in a school environment, I would say it's typically not the case. Um, and so but I think the bigger issue here is that people put so much faith in that school vaccine mandate, and like those are the vaccines we need. But the interesting thing is that HPV is actually recommended exactly the same way as meningococcal and Tdap from the powers that be. So the CDC and the ACIP, which is the Committee for Immunization Practices, they are the ones who decide, you know, the schedule and what age is best for the different vaccines. And they make recommendations. And there's different types of recommendations. But the type of recommendation that they make for the other adolescent vaccines, which again are Tdap and meningococcal, is the exact same recommendation that they are making for HPV. So I think that it's a common misconception that HPV is optional because it's not school mandated. But really, they are equally important. They are recommended exactly the same way. And so I wish that we could get away from thinking that just because it's not school mandated means it's not needed, because school mandates are protecting kids at school. And this vaccine is equally important, even if it's not necessarily for a school environment.
I think that's a great point. I think we've kind of tied those loosely together to help increase vaccination rates. But I think looking back on it, like you said, it's not optional. I mean, it should not be optional. It should just be, as Dr. Perkins said, it's a human vaccine. It's a human virus, a human vaccine. Everyone should be getting this vaccine. So I appreciate that point of view. So we're now going to go to the individual programs and community efforts with Melissa and Andrew. And, I want to talk about, first of all, can you share how your organizations are helping make HPV more accessible to communities? Because we talked about how HPV vaccine is expensive. You have to have a 2-dose or 3-dose, depending on your age group. And depending on your insurance provider, or, you might not have access to that. So, how are you making it accessible? Your organizations are making it accessible to the communities right now. And I think I'll start with Melissa first, and then we'll go to Andrew.
Awesome. So just a little bit about me. The clinic that I work for, Indian Health Council, so we primarily serve the 9 consortium tribes in the northern part of San Diego County. So the great part about this clinic is all of our services, medical services, dental services, behavioral health services, including vaccines, is all free for the native tribes in our area. So cost and access in that sense is not really an issue. What we do to facilitate the vaccines is we do 3 main things. So we say social media, printed media, and then community outreach. So we have all of the social media channels, like Facebook, Instagram, TikTok, and we have our own website as well. So we make sure that all of that health information is out there, especially for the teens that are always on their phones and stuff. Printed media, we make our own flyers and pamphlets that include HPV information. So my program specifically focuses on specifically HPV vaccines and cervical cancer screenings. So I pretty much pulled information from different websites, created our own pamphlet with information to make sure that the art and the information is culturally relevant for the community, so it's received as best as possible by their patients here. And then community outreach, year round, there's a lot of health gatherings at different tribes. Each tribe hosts their own events. So we make sure that our programs are always out there at each tribe so they know us. A lot of times our providers are really integrated in the community. So if they have questions about what is a cervical cancer screening? Is it the same as a PAP, or what's a PAP? What is HPV? Why does my kid have to be, why are we doing it at 9 years old instead of 12? All those questions. So we have our providers, our health educators out in the community, and a lot of them are from the community. So that really establishes the trust between them. And I think community outreach has been the biggest plus for us. Having that face-to-face interaction has seemed to work the best so far.
That's great, and I'm glad to hear it. And it's also, especially being in California, I understand that it's a lot of rural communities out there. It's quite far to get access to actual clinical care. Like there's sometimes 2-3 hour drives, to get to a facility. So it's great that you're going into the community
Yeah.
and making sure that they have the accessibility to that. Andrew, could you speak to, that as well? How is your organization helping to make the vaccine more accessible?
Yeah, so our organization is called Champions for Health, and we are a medical nonprofit that is contracted with the County of San Diego to do mobile vaccinations. We've been doing this work before it was cool, before, we received the COVID vaccines, really focusing on flu. But what we do is we go out to the school districts and do school located vaccine events, which is what the state calls it, or SLEED. We're at your grocery stores, we're at your faith-based institutions, we're at your parks. Our goal is to make sure that it's accessible to when you have the time. We understand that, for families, it could be really hard to make that appointment, that doctor's appointment, or your child gets sick, so you miss work, you miss this, right? But we're available on the weekends, we're available after hours. Um, Being a vaccine provider, vaccine for children provider, VFC, has been a roller coaster, but a blessing because we have seen that parents are very happy to have these vaccines available at our locations. Specifically for those who may not have access to health insurance, or their child may be on Medicare or on Medicaid, trying to figure out what those options are. And even for those with private insurance, having the time to be able to discuss what does it mean, about my insurance side, what other vaccines can I get? But I think a big thing that we also talk about, and that is really big in our culture, in our organization, is that a lot of our providers are from the communities that we serve. So a lot of our providers speak multiple languages, are coming from the communities, look like the community. So we are very well versed on how we can work together and improve the healthcare of those that truly need it. The other thing too is that we worked with the county to provide free health presentations by healthcare providers who speak on a health topic. So let's say for you, if you're in San Diego County, but I'm sure there are resources like this in your county or in your state. If you're looking to have someone to come to your group, your book club, your PTA, whatever that might be, on to speak on vaccinations in general or on HPV, I'm sure you can find a speaker from your local San Diego or Black Nurses Association, Philippine Nurses Association, Hispanic Nurses Association, coalitions like that are throughout the nation, in the state, in your county. These individuals are eager and happy to provide presentations and educate, because they do want to make sure that people say that their community and their folks stay healthy and protected.
That's great. And I think you brought up a great point that it's not just the cost and the time, but it's also the language barrier. And I know, Melissa, you said that, your pamphlets and your printed material are very cultural, rounded in that, rooted in that. But Andrew also brought that great point, is that it's a language. I mean, in California, of course, we have multiple languages, and there's, a lot of Spanish, there's Chinese, there's a lot of different other languages. And so it's great that you guys are taking that effort and addressing that, especially with educating the community. And the fact that you're like churches, parks, grocery stores, it's like next time I go to a grocery store, I'm going to be looking out for your van or your bus there. So let's talk about, now we talked about all this, the organization you're doing, but is there any obstacles that you feel that you're seeing, that you're facing right now in regards to HPV, the HPV vaccination, and kind of getting the vaccine and education out? Melissa, do you want to go first?
Yeah, I can start. I think the main thing, I would say 8 times out of 10 when I talk to parents, about the HPV vaccine for their child, one, they're really shocked that they can start at age 9 because they're aware of HPV and how you get it. So in their mind, I feel they believe that if they give their child this HPV vaccine, it's giving them permission to become sexually active. So I think it's just a stigma that this vaccine holds, and I think we're working really hard internally to rephrase um, that messaging and really focus on the cancer prevention, not the sex education or how you get the infection. And that's, I think, has been our biggest challenge, just kind of getting that hurdle and really reframing the conversations around HPV vaccine.
And that's great because we talked about the misconceptions right now, and Dr.
Mhm.
Perkins and Sarah also mentioned, it's a vaccine that should be for everyone. Doesn't matter, and also a cancer prevention vaccine. So this is, and it's hard because I think that is the stigma that has been attached to HPV, and then also with the HPV vaccine. So I do see that concern as well. Andrew, do you have anything to add to that?
Yeah, I mean, I agree with what she said. I think for us as being a mobile provider, and I'm sure Sarah could talk about this too, of having access to the vaccine, having the inventory, doing the order through the VFC program, which, can have its ups and downs, and making sure that you have things available. But I would say now that it's flu season and it's COVID-19 season, quote unquote, and we're ready to roll out these new vaccines out in the community, to be able to really have those conversations with parents and with young ones if they're interested. Oh, you're getting your flu shot. By the way, here's your HPV if you're available, right? And then having the time to educate and also give them the resources as we shared. We're not trying to push, just educate. And when they're ready, for the next time they may see their provider to be able to maybe say yes or ask more questions.
That's great. No, I think that's a good thing because I don't think we think of logistically how we get the vaccine. So I think that, and that kind of rolls into another question we have was, between, the two of you, and Sarah, if you want to jump in as well, how can the government really help with these efforts? Because I think, we're doing it now. We're doing these patient webinars. We're trying to educate the public, and there's a lot of emphasis on what parents can do. But is there anything that you would like to see the government, federal government or state government even, or even your local government help with these efforts? And I'll start with Andrew first.
Yeah, for us, I mean, I think because there's so many vaccines for the Vaccine for Children program, uh, really working with providers to be able to give them the tools as there are a lot available to educate the providers so that when we're having these conversations with the parents and guardians, it's great, but trying to figure out how if we're since we're doing this new model to an extent here in California to do these offsite mobile events, how can we do a targeted message if it's going to be at a school, right? How can we do a targeted message if it's going to be at a faith-based institution so that we can tailor these messages a bit to the population that we're serving?
That's a good point. And I do like that because I think it's, not just a time to vaccinate, but also a time to educate, right? It can go at the same time. Melissa, do you have anything to add to that as well for like what government can do, federal, local, state?
Yeah, I would say they can keep funding these programs because a lot of them at least in our clinic, they're grant funded. So we'll have it for 1 to 4 years, and then after that, we're kind of just like left on our own. So I think just keep funding these programs. If we're seeing results, then I feel like there's no reason to cut the funds if something is working and the community is receiving it well.
Great. Always about the funding, right? Gotta make sure that's there. Sarah, did you want to add anything to that?
I did. I kind of mentioned earlier, but there is an adult vaccine program. It's called 317, and it's very much like vaccines for children, and that it's available to every state, but it's for adults. And there's also been some government discussion about a vaccines for adults program. So maybe we will see that in the future. I don't know if that's going to be coming anytime soon. But with the 317 program, depending on how your state uses that funds, it can offer other vaccines. So again, I'm from Indiana, so I know a lot about Indiana. And luckily, our 317 fund here does cover HPV vaccine if you're over the age of 18. Now, a lot of states use 317 funding for flu vaccine mainly, or flu and COVID. So that's purely a state by state thing, but I do hope that maybe we'll see a vaccines for adults program where that will be available to everyone, much like the VFC program is for kids.
Oh, that's great. I think that would be a good boost of that as well. Because I think as a parent, I forget to take care of myself as an adult, and so always focusing on our kids. So I think that's going to be a great thing. Um, between, Melissa and Andrew, and even Sarah, if you wanted to answer this, I think Sarah mentioned this a little bit, but do you have any, recommendations between, what suggestions can you offer parents who are really trying to obtain the vaccine, but just unable to? They find it difficult. Melissa, I know you said you're going into the communities so that way they don't have to drive out. But is there any other resources that parents can look towards, if it's not just the cost, but just access, getting the vaccine? I think that's sometimes the difficult part of working parents trying to accommodate sports schedules and after school activities, right? How would one parent at least try their best if they're wanting to get their kids vaccinated? What would you guys recommend? And I'll start with Melissa first, because I know you mentioned the community that you work with.
Yeah. I think for us, we did see that there was a need for extended hours at our clinic, not just for vaccines, but for all medical and dental services. So we changed our hours actually. So we're open until 6:30 to kind of accommodate that. And then we also have mobile units that go out into the more rural areas a couple times periodically to make sure that those folks that are up in the mountains are still getting the care that they need. So I know that's very specific just to the tribal consortium tribes that we serve. So I'm not sure if maybe Andrew can speak to other resources.
Definitely.
Yeah, I would say, at least for the state of California, I'm not sure if it's a national thing, Sarah, you could probably confirm, but you can Google My Turn. And I think My Turn might be, My Turn is here in California. If you're looking for a vaccine, providers that either if it's just a clinic, a standing clinic, or they have mobile events, we are asked to put our events on My Turn and list the vaccines that we are offering. So for example, if it's an open event to the community, if it's going to be at a faith-based institution, we would have it there. You would see the location, the address, and what vaccines would be available, and if it's through VFC or private, whatever it may be. Some locations may ask you to make an appointment. A lot of locations are walk-up, so you don't need to make an appointment, but at least you can kind of see what's available. Here in the County of San Diego, since we're contracted with them, all of our events, if you Google County of San Diego immunization schedule, you'll see all of our events. We host about 100 clinics a month all over the county, so there's bound to be one that kind of works with you. But again, that's San Diego County specific. But really use My Turn if you're here in California. Again, Sarah, I'm not sure if My Turn is available in other states, but if not, call your provider and see if they do have that.
And Sarah, did you want to speak on the more of a national level? I like how we went from very community to state to now to the bigger picture here.
Yes, I'm very jealous of the My Turn program, Andrew. It is just California based, but it's an amazing system that other states are envious of. But yes, I think that as general guidance, I think your local health department is a great place to start. So if you're in a place where you really don't know where to start, local health departments are typically in direct contact with the state health department, and those are the two places that are going to know the goings on of vaccine events in your area and in your state. So if you really are having trouble figuring out where you can go, that's where I would start.
Perfect. And so I wanted to thank all of you guys for being on this panel today. I mean, it was a great discussion, and Dr. Perkins, who had to leave a little bit early, but I'm so grateful for your information and providing that information. And just to kind of wrap up, the HPV vaccine is for everyone, as Dr. Perkins said. It's an everyone vaccine, boys or girls, anybody ready, anybody. And we talked about the guidelines, recommendations. And I think, just to wrap up, we talked about the misconceptions. We talked about all demystifying that, but we also talked about making sure that it's accessible and available. And it is, it's available. You should educate yourselves, not only as an adult or as a student or a teenager. This is the thing, this we need to educate ourselves and our communities to demystify these misconceptions of HPV and the vaccine. So, and I'm so grateful again for all of you guys, Andrew, Melissa, Sarah, and also Dr. Perkins for being on. And it's been a great discussion, and I look forward to the next webinar. Thank you.
Thanks so much.